Hi guys, this is Dr. Ava, and today I wanted to talk to you about having an oopsie. Oopsie stands for unprotected sexual intercourse, and if indeed you are having an oopsie rather than just having unprotected sexual intercourse because you're trying for a baby, there are contraceptive methods that can help you in an emergency, and there are 3 types. 2 of them you probably have heard of before, and they are together called the morning after pill. First type of pill is called Levonorgestrel. The second type is called Ulipristal. The first type of pill normally is given within 72 hours of you having an oopsie. The second type of pill can be given up to 5 days of you having an oopsie, and that's the Ulipristal pill. And the copper coil can also be within 5 days of having an oopsie. However, one thing to be aware of is that even though we're having these timelines, we also need to think about the time of ovulation. What I mean by that is, if you have released an egg already and you are having the pill, there might still be a chance of you getting pregnant. And if that's the case, you can still try and have your pill, but you need to make sure that you do a pregnancy test a few weeks later to see if you are pregnant or not. But how do you decide between which type of emergency contraception to use? The most effective, we say 1 in 1,000 women, only 1 in 1,000 women would get pregnant, is the copper coil. Copper coil itself is a coil that we put into the womb, and it can remain there for up to 10 years to be a form of contraception itself. So it's a very good form and effective long-term use of contraception. However, there are a few side effects that are not very liked by women, but only some women. You can have very heavy menstrual bleeding, and it can be painful as well. But if you take the correct medications during your period, who knows, you might be one of those women that are perfectly fine with it. And the other types, which are the morning after pills, the Levonorgestrel and the Ulipristal, they are only used for that one form of emergency. They cannot be taken in the long term. And side effects of those can be, if for example you vomit within 3 hours of taking those pills, you might need to have to retake them again. And then they can give you other side effects, for example, having an irregular cycle a little bit, some breast tenderness, some just nausea, feeling generally crap within the time of you taking it. But those side effects would go away. So I hope this gives you enough information to decide which type of emergency contraception to use. Like I said, the copper coil can last for up to 10 years. The morning after pill, like the title says, it's mainly for the morning after, and it's not a long-term type of contraceptive. But it's your body, your choice. Thank you.